Welcome to the Mediclinic Breast Cancer series. Today I will be talking to Dr. Veronica, who's one of our breast surgeons here at City Hospital, about the risks of breast cancer. Hi Dr. Veronica.
Hello,
How
Dr.
are you?
Major. Good, thank you.
Okay. So thank you for taking time out and discussing the risk factors for breast cancer with us. The first question I would like to ask, could you please let me know what causes breast cancer?
Okay. So thank you for this question, Dr. Naida. So as any other breast cancer results from a DNA mutation that instructs a cell to grow out of control. And I would say that in this particular case, the DNA mutation targets a cell within the breast tissue. So we don't actually have any particular cause for the disease, but we identified many risk factors. And it's important to remember that if a woman has one of these risk factors, she has a higher chance to develop breast cancer. But this does not necessarily mean that this patient will develop breast cancer. Likewise, if a patient doesn't have any of these risks, it won't necessarily mean that she won't develop the cancer.
Okay, so what are the specific risk factors for breast cancer?
So more than anything else, I'd say being a woman is the highest risk. But this does not mean that men cannot have breast cancer. At least 1% of breast cancer are present in the male population. Another risk factor is age. So we all know that the older you get, the higher the chance to develop breast cancer. Among the other risk factors, we have family history or genetic predisposition. I would also add radiation at any time in your lifetime, and also the fact that a patient might present with some precancerous lesion, for instance, atypical ductal hyperplasia. There are other risk factors, for instance, having children at what is scientifically considered older age, having few children or not having children at all, late menopause and hormone replacement treatment is another risk factor. Alcohol and smoking are also risk factors, but these are modifiable. So once you stop one of these, the risk will go back to the one of a normal population.
Okay, you mentioned family history. Can you tell me a little bit more about this, please?
Okay. So family history plays a very important role in whether or not a woman can develop breast cancer. In particular, women with a first-degree relative, like a parent, sibling, or a child with breast cancer, can have twice the risk of a woman without such family history. And it's important also to remember that if this relative presents with breast cancer before the age of the physiologic menopause, the risk is threefold.
Okay, so if someone is watching this video and they want to know more information, what would you suggest?
Well, first of all, I would suggest that they make an appointment to discuss these risks, and I will be glad to guide them through the best course of action for their individual situation.
Okay, thank you, Dr. Veronica, for your time.
Thank you.